Good afternoon, everyone. We got the UTI here, but this is a special edition today. I'm Lisa Marie, and you are.
I'm Danielle Regalado. I'm a nurse practitioner, board certified.
Yay! And today we're going to ask questions about ultra running. I know that I've been talking to some of you lately, and y'all have given me questions, some strange, some not. So we're going to probably do this a few times. Today we're going to start with light questions. And first, how are you today? Happy Mother's Day.
Thank you. I'm doing amazing. I'm super excited. I'm energized and I'm ready to get started.
All right. Well, so the first question is about hydration. So as runners, we have to hydrate a lot. We drink a lot of water. We drink stuff with electrolytes. Some taste good, some taste bad, and we have a lot of salt. We take salt tablets, salt. We eat salt chews. But I thought maybe today you could tell us about hydration and what we need and signs that might be for dehydration.
Yeah, so there's two ways to get hydrated, oral and IV hydration. So a lot of times marathon runners will take water and maybe electrolytes on the go because who has a doctor that they can just be like, hey, give me an IV? So that's why we have our med spa here and we're implementing the IV hydration. IV hydration can include all the electrolytes as well as supplements and minerals that we don't get through those packets of electrolytes, which are glutathione, which are good for your joints and your muscles, and also amino acids that are necessary. So some of the ones that we like to use are B complex vitamins. Those ones sometimes do come in those little packets, but glutathione doesn't. And that one helps to detoxify your body and reduce inflammation. You talked about some salts.
Mm-hmm.
Is that the Epsom salts or they're just tablets?
They're tablets.
They're tablets.
Sometimes they come with ginger in them, which for some of us, I can't take them because it gives me heartburn, and so I'm having to actually take Pepsid AC and stuff on the run.
Okay. And then we also offer magnesium in our IV hydration, so that one reduces muscle cramps and aids with muscle recovery. Also, taurine and amino acids, which is helpful for muscle repair and performance enhancement. So it's really good to make sure that your body is super hydrated, has all the supplements and minerals that it needs to carry on, because you don't want to go malnutritioned or dehydrated.
Now, would you do this before your run? Like, I know a lot of 100-milers, there's some very, very hot ones. And I see them, the med people are there, the emergency services, and they're having to actually give IVs because we get dehydrated so quick.
Yeah.
So would you suggest this before or after?
And after. Before and after. Because, like I said, whenever you're going through a run, you're going to exhaust a lot of that muscle, a lot of that hydration that you already have in your body. Every cell in your body is working to get you going. So if you already have a good base of amino acids and vitamins in your body, you're going to be a lot better off.
So do you have any signs of dehydration?
So, yes, some of the signs of dehydration, the first sign of dehydration that we all know is thirst. So, you're going to get thirsty, your body's going to be calling for you to drink something. And then also dark urine. So, when you go to the restroom and your urine is light yellow, then you're hydrated. When it starts to get dark and more odorous, then it's more concentrated. So, that means basically you're producing a lot of that urine very concentrated. You don't have enough fluid in your body. And then also fatigue and lightheadedness. When you start to feel fatigue and lightheadedness, there's less fluid and less circulation in your body, less volume in your body. And that's when you're starting to get those symptoms of lightheadedness. You're not getting so much good circulation in your body from that fluid loss. And then also reduced endurance. So you're going to start to feel weak. And then you're just going to start getting slower.
Would hallucinations play into this?
Hallucinations is more of a severe dehydration symptom, yes.
So that's the point that we would just need to stop and try to get as much water. Is there a point that you can't replace the water that you've lost?
No, you can still replace the water, especially with IV fluids. Like you were saying, some of the EMS will be there and start IV fluids, and that's when they start to have those hallucinations. So whenever they start to get hallucinations, that's when we start to know that it is more severe. And that's when EMS starts to step in and start asking simple questions like, what is your name? What is your date of birth? And if they start to forget, like, oh, when was I born? That's more hallucination from dehydration and borderline heat stroke. So that's when they really need that medical care.
Wow. So I know some people who get dehydrated, they also get cold. So I guess their body will start reacting that way as well, even in the heat.
Yeah, they obviously are getting super hot. They can't regulate their body temperature. And then their body tries to preserve all the vital organs. And sometimes we'll end up with those symptoms as well. And we see that a lot around here in the desert. So some people end up having a heat stroke and they're past the point of even sweating. Sweating is one of the things that helps cool us off.
Mm-hmm.
When you're having a heat stroke, you're not so much sweating anymore. Your body is just trying to preserve those fluids to preserve your organs.
So the takeaway here is stay hydrated. So your med spa, they offer all kinds of neat little things that you can do, and okay.
And actually, we do have a special one that we're going to be doing for runners. And I bought it specifically because you have me on your show. And that one has a lot of vitamins and complexes to hydrate specifically runners, especially that are losing a lot of those essential molecules that we need for our body and the essential molecules that we need for cell proliferation and things like that.
Right on.
Should I get it? Should I go grab it?
Oh, wow.
So we have these new IV infusion kits. One of them is called Recovery and Performance by Olympia Pharmacy. So this one has a lot of different things. So I'll go and open it and show you guys.
Unboxing video.
Unboxing.
Unboxing. So we have our vitamin C, our Olympia Vita Complex. So that's niacinamide, dexpanthenol, pyridoxine, magnesium, zinc, magnesium chloride, magnesium sulfate. So there are two different ones. Copper. I've been doing a lot of copper as well. That one is more for the hair, and it's a complex that we use to make sure that we have good hair and not like silvery, graying too soon. Citrulline, proline, and a lot of different things. And then we also have this one. This one is Get Up and Go, and this one burns fat. You feel energized, and it boosts your metabolism. I would say this one is probably your better one that will do for you. This one is jam-packed with so many good minerals and vitamins. Let's see. Thiamine, riboflavin, niacinamide, dexpanthol, and pyridoxine, vitamin C.
Wow.
And then we have our Olympia Mineral Blend. This one is magnesium chloride, magnesium sulfate, zinc, and copper gluconate. And then our amino blend. And this one is arginine, citrulline, lysine, and proline. So all of these are essential. We don't eat spinach every single day. We don't eat our greens like we're supposed to. And a lot of times whenever we're talking about dehydration, we can throw malnutrition in there as well, because if we're not eating spinach and celery and green beans every day, we're not getting the amino acids, minerals, and all the vitamins that our body really needs.
Yeah, in our aid stations, generally it's bacon
Protein.
quesadillas,
Quesadillas.
bacon in each hand, and there's some fruit there, but the runner just grabs and goes. So they're, so you're saying that could sometimes help with that dehydration.
Yeah, that will definitely help, especially zinc and copper help with your energy levels. And then we know that vitamin C helps with immunity. So keeping your body healthy from head to toe is very essential.
And our hands aren't clean when we're grabbing these things, right?
Exactly. And then your feet are getting affected as well, right?
Yes. So the next one is trench foot. Renee, who is sitting behind the camera and not sitting with us today, recently was pulled from a race because he had severe trench foot. And he ran in water and only brought one pair of socks for a 72-hour race. And
And
He was nasty. It was very,
Don't
very
runners
nasty.
bring more than that just to kind of keep their feet
I
They
clean
do.
and dry?
They do.
They do?
I do. Every 12
I learned my
hours, I
lesson.
change.
It's 2 years ago. So.
That's a amateur mistake.
Right. But we were on a race a few weeks ago, and a flood came. We didn't change our socks because there was not enough time. I mean, by the time you would change them, some runners just, we don't get the time.
Yeah.
And we do this to ourselves, of course. And if you're soaking wet, you just can't put on a new pair of Injinjis. So I actually had trench foot. It was nasty. I did
Oh.
not take a picture, but it was nasty.
Yeah.
So I thought maybe you can discuss a little bit of trench foot.
Yeah. So trench foot is basically the foot starts to rot. Basically, the tissue dies. There's less circulation. There's a high risk of infection, especially when you're running in dirt and mud and then water, and all of that kind of mixes together. There's a lot of bacteria in dirt. We know that. And then there's also metals and tetanus and all these other things that could get mixed in there as well. And one of the very, very severe side effects that can happen with a trench foot is amputation. So it's very important to keep your feet dry, clean. Wear shoes that fit properly. They cannot be too loose and they can't be too tight. If they're too tight, less circulation. If they're too loose, as you're running, your feet are hitting the front of the shoe and then affecting those toes, especially the circulation of the toenail. So those toenails end up suffering. And then also, like you mentioned, socks. So you need to change your socks regularly. Bring a lot of socks with you and wear them like a necklace. That way you just have them with you, tie them into a little necklace, and as you're running and you need socks, there you go.
Yes. And we do try to do that. I think that as runners, we do fail miserably on this one. It's, you're in all kinds of elements, snow, rainstorms, your feet sweat. I mean, I think with
Yeah.
him as well, because he didn't change for so long, they sweat. I mean,
Yeah.
yeah, we're not going to pick on you too much, Renee.
One
but-
thing that we do here at the med spa, I will mention, is hyperhidrosis, which is sweating, and we inject the toxin that we use for our face. We inject it for the underarms as well as the hands and the feet for the sweating. So that I'll just throw that one in there.
Okay, never had heard about that before. Wow.
Never heard of that one?
No.
Yes, that one is something that we actually do for teenagers as well, that they soak their shirts from sweating, and it causes like a risk of bullying or self-confidence issues, and that's one that the parent will sign consent and we can inject them for the underarms, and they just have that less sweating and they feel better about themselves.
Wow. That's so interesting.
Yeah, we even do the crown of the head for the sweating and the groin as well.
We can talk more about that one later.
Yes.
Okay, so toenail loss. So us ultra marathoners, we lose toenails. Right now, I will say that I have lost all 10. I feel like I have birthed. Generally, I take black toenail polish and there's skin there, and I pretend that I have toenails.
Okay.
We generally lose them while we're running as well. Ultra runners are when somebody loses a toenail, they have to take off their sock. We will all stop and look at the toenail as it just comes out of the sock. It's a rite of passage.
Oh my god.
Some people tape the toenail back on. Some people get giant blisters and will just pop that sucker and keep going. We do a lot of strange things. So
Yeah, but the toe grows back.
yes,
Yeah.
and they're a new thing. I've never heard of this until recently. Some ultra marathoners are actually getting rid of the big toenail and having it surgically removed.
Why?
I don't know. I thought maybe you would know. But
Okay. Well, it can be removed. I actually have a cousin that got his removed, and it was more of because of an infection. But when you remove it from the root, then it won't come back. Or if you have an injury on the root, like a lady that I know got stepped on by a cleat, and the toe it killed it. The toenail's gone. It'll never come back. So I'm wondering if maybe they're removing the toenail, so that they don't have that issue anymore and they can run comfortably. Because
Possibly.
a lot of pain when you're running and those toenails are hitting, or if the shoe is really tight, you get pains, aches and pains. So if you remove the toenail, then you won't have that issue, I guess.
Right. So I run mountains. I run technical trails, and so you can see my shoes. Y'all can't. Well, so I do have these, but my toenails, the only blisters I get are underneath the toenails, my big toenail, matter
Okay.
of fact.
Okay.
And so my toenail lifts up, but it does not come off. About once a year it does come off, and I'll pop it underneath. So is it safe for me to stick a needle and pop that underneath the toenail, or am I doing wrong?
Usually we say we don't want to pop blisters because in the blister it's completely sterile still. When you pop a blister, you could potentially cause an infection. But I tell people clean your skin really nice with alcohol, burn the needle to kill any bacteria. Usually wash your hands first before you do anything. Clean the areas, both needle and the toe and the blister, and then you can pop it and then keep it clean after that, because when you pop it, you're introducing a hole, and in that hole is a very easy time to get an infection in there. But I think a lot of people know the signs and symptoms of an infection, which is redness, swelling, pain, leaking, and smell. So if any of those symptoms happen, then you need to see a doctor for antibiotics.
So when we're running these races, we do introduce. We already have the smell, the dirt. I mean, I can remember last year.
So it's like ruling it out. Like, is it odor from the run or from the infection?
Yeah, because we have no pain. We have pain tolerance. We
with all of that like adrenaline.
Yeah.
Pain comes after.
So like last year I was at the Cowboy, and this guy had a blister, and I'm like, hey, can I pop it? He thought I was medical. He hands me a needle, and I'm just like.
So he let you.
Yeah.
Like, yep. Oh, she sounds like she knows what she's doing.
Yeah. I didn't. I had ultra runner experience.
Yeah.
But yeah, we do tend to pop our own blisters if we have to, because running with them is, do we
More
leave it in the
painful.
sock, or do we pop it and just put the sock back on and go? We know it's dirty. We know that we need to have a lot of things.
But
that
if
we
you're
should.
healthy and you have been taking your zinc and vitamin C and all those things, then you shouldn't have a problem. If you're sickly, like you have diabetes and all these other comorbidities, then you're at higher risk already. But if you're doing your supplements and doing all the things that you should be, even if you get a little bacteria in there, it's not going to turn into a huge infection. Your body will eat that infection right away.
Right on. This is good to know.
And also, I think popping blisters could be a good thing, especially if it's under the toenail, because when there's a lot of inflammation, it kind of cuts off circulation. There's not enough blood flow. It's kind of like just a big bubble, just not letting the blood pass. And so when you pop it, then you're getting oxygen to the tip of your toe and then the toenail as well. So it could be a good thing.
Yeah. So you're saying that we should not use duct tape then?
No.
Okay.
Don't. I mean, if that's the only thing you have, then that's the only thing you have. But I know some people, I've had family members that would cut themselves. Back in the day, they will put super glue to kind of glue everything together. And now what we use is a medical grade Band-Aid, liquid Band-Aid, and we just put the skin together and put that liquid Band-Aid. And the concept is basically to kind of close it up and let it heal. I mean, if you only have super glue and you're a mechanic, that's what you got to do. That's the survival mode, right?
So I guess I want to know in the comments below, what have you used to fix a blister? I do know people get giant blisters under their feet, and they do use duct tape, so they think that it will cause no blisters. Not saying any names, Scott. And and they'll do that. I know some people get it up their legs, and but it's something we deal with, and it's a common thing. It sucks.
So does the duct tape kind of like add an extra layer of strength to your skin? Is that maybe what they're doing? Because our skin is very sensitive. If you're causing a lot of friction, there's a potential blister that can happen, just like people that go to the gym and things like that. So I'm wondering if putting that duct tape is adding an extra strength to the foot to prevent blisters. Is that kind of why you guys do that?
I don't do that, but I do know some people do. So yeah, she would like to know, what does that do
Is
for
it
you?
helpful? Does it help with the pain? Does it help with the blisters? Is it working?
Or you just do it just to disgust everybody? So this and this also brings into the chafing. So we all use squirrel's nut butter or something like that, and we put it on before the race, and it puts a barrier on the skin. But after so long, you can get chafing. So I've seen duct tape used over chafing before, and I'm just like, no, why? But I believe it's for the clothing not to touch them, or they're using what is it, medical tape? Like if you have a muscle, what is that? When you're using like a sore muscle, and you're putting the tape,
Like a band?
like a KT tape.
Okay,
Yeah.
okay.
So they're using that as well.
Okay, I have some KT tape. So it's, I think that is the same concept. It's an extra barrier to protect the skin. So just like we put for babies, we put certain things, like we put knee pads on babies when they're crawling and things. As we get older, we need to protect our skin, especially if we're above a certain age range, then our skin gets a little bit thinner. And I guess that extra layer of tape is helpful. And then also to thicken your skin, we should be doing collagen. So collagen supplements, so, collagen powder. I even do collagen with my coffee. It's hazelnut creamer collagen. So lots of collagen to thicken your skin, to protect it. And actually our skin is our biggest organ in our body, so we definitely need to be good to our skin.
Yes, absolutely. 100% agree. Aging sucks.
Guys too. Guys need to do collagen, and honestly, I think Chuck Norris does like a supplement or something. But guys need to start getting on the supplement bandwagon and protecting your body, collagen, sunscreen, and all the vitamins and minerals as well.
Right on. So I think I have a couple more questions, but one of them I think that you and I had spoke about whenever I brought this idea to you to come on do the podcast was I called it the UTI. And you were like, oh, why are you naming your podcast the UTI? So really it's your ultra trail investment, and
Okay.
it's is what you're putting into your body, or the clothing you wear, or the races you do. What is your investment that you're putting in? So I thought maybe you might want to talk about how to prevent a UTI on your long distance run.
Yeah, UTIs happen to everyone, anyone, and then especially if you're an ultra runner, because you're dehydrated, and that's one of the main things that can cause a UTI. So lots of water, like we said, and then electrolytes, but making sure that you're peeing when you need to pee. When you hold that urine in your bladder, it can fester a bacteria. We know that urine is sterile. The minute that it's not sterile, infections happen. And infections can happen in the bladder, the ureters, or the kidneys. And when it gets to the kidneys, you're almost going to be peeing blood, because your kidneys are very sensitive organs as well, and they don't have muscle. They depend on the heart for a lot of things. And sometimes some people don't get symptoms of a UTI, like that burning when they pee. Some people get atypical UTIs where they're just like having back pain, and they don't know where this back pain is coming from, and it's an infection in the kidney. It completely, the bladder doesn't really, it's filled with infection, but they're not peeing and having pain. The pain will be in their back, and that's an atypical symptom of a UTI. You need to get treated with antibiotics, especially because you don't want to cause any harm to your kidneys. We need our kidneys. They're a vital organ, and if the kidneys go out, then every other organ starts to slowly go out as well. And then so they say azo tablets help as well. The theory was that cranberry had little molecules that were fuzzy little molecules that would clean your system out, and they worked like a broom. But a lot of cranberry juice has so much sugar that it kind of contradicts that anymore. So the azo tablets are helpful. Vitamin C, because we know vitamin C is very good for your immune system. So if you start to get a UTI, if you have enough vitamin C in your body will eat the infection and do its job. And then more clothing that doesn't prevent oxygen getting to the urethra and things like that. So we don't like really spandex, especially if you're running a lot. We like cotton in that area so that there's good oxygen flow, because whenever there's something super moist and there's a lot of like plastic or spandex or what's the other one,
Polyester
polyester covering that area, causing a lot of moist and water, then that can lead to an infection as well.
So if you're on the run and you're starting to feel these symptoms, can you get behind them to finish, like you're running a 100-miler? Can you get behind that? If you start feeling like,
start taking the tablets,
Yes.
I would start taking them before, and vitamin C.
Okay. Okay.
Pump your body up, make your body happy and ready to go.
Okay. All right. So I had 2 viewer questions come in, and one of them I thought was a pretty interesting one. She just was finished running the Gila Monster 300 miler down in Arizona.
Oh.
And she wanted to know, afterwards she got into an Epsom salt bath. Does it, in my mind, I'm like, okay, well, doesn't that take the swelling out of your legs and your feet? But she wanted to know, does it dehydrate you more than you're already dehydrated?
So Epsom salt baths are common for runners, especially after a run and they have body aches. If you're doing it for 15-20 minutes, it shouldn't dehydrate you, and it should actually relieve a lot of aches, pains, and swelling. But if you're doing like 20 pounds of Epsom salt, then yeah, you can probably have some kind of reverse osmosis where it's dragging that fluid out of your body. We don't want that. So a 15-20 minute bath soak is perfect, actually.
Okay.
A lot of runners do that.
Okay. So there we go. And the last viewer question I had, and this come from a lot of women, and we're going to touch on it. And if y'all want to hear more, we are going to be having a show just on it. It'll be on just my podcast, and it's on is it perimenopause? Is that how it's called?
Perimenopause. So that's before you're getting into menopause and your hormones are all over the place. But we actually go through that twice in our life. So when we're teenagers and we get our menstrual around 11, 12, 13, maybe even 14 years old, we start to deal with a lot of acne, mood changes, irregular cycles. And then if it's much of a problem, then you'll go to a doctor, and then we would give you hormones to start with to kind of regulate your cycle. Those hormones more commonly are known as birth control, but they're also hormones to regulate your cycle. The side effect is birth control. And then as we get older, we go through it again. So a lot of people stay away from doing hormones. They're like, no, cancer risk. But actually, it's very common. A lot of people are getting hormone replacement, as well as men as well. Men are losing their testosterone a lot more now than they used to. They're not playing with a basketball every single day. They're not out there roping cattle and things like that, building that testosterone. So they're losing testosterone. So they usually get on hormone replacement. And women should also as well. When you start to notice that you're losing a lot of your hair, you're gaining a lot of weight, you're having a lot of fatigue, then that's when your hormones take a dip, and we should replace them. And then once you start replacing your hormones and leveling and stabilizing them out, you're not going to deal with that insomnia, the fatigue, the hot flashes, hair loss, the weight gain. You're going to stabilize your hormones to where you're losing weight without even trying. You're getting lots of hair, and you're feeling happy, and your libido goes through the roof. So that's another topic for another day, but definitely hormone replacement is an amazing option.
I want to hear more on this, especially that libido.
Yes.
And I think that is something that us women do want to talk about. And yeah, I look forward to having you on to talk about that and some other special topics.
And I am implementing IV infusions for biotin. It has biotin in it and a bunch of other complexes that help with the hair. So as I mentioned, I'm doing the copper to help with the graying, because copper is an essential mineral that we need to produce the melanin that our hair produces. So I'll be doing a beauty kit for that one as well.
Oh, wow. Now, I've never done any of these, but, I am very interested in it. So I just wanted to make sure everyone knows that I have not tried this yet. So
you'll be my model. We'll be starting it on you.
Okay. So is there anything else you wanted to add about your spa or...
I'm located here in Deming, New Mexico. I have patients from all the way in Tucson, Safford, El Paso, Texas, Colorado, Albuquerque. I would say come down and come visit me. I also just opened a new place in Las Cruces, New Mexico. And so we're kind of expanding, and patients from all over are welcome to come see me.
She also does butt injections.
Yes.
I don't know
it's a filler.
It's a filler.
So we do a lot of things. Check out our website, and it will be in the link below.
Right on. Thank you for watching, everyone.
Thank you.